Welcome to this explainer. If you're tuning in today, there's a really good chance that you or your partner are navigating the, frankly, incredibly challenging journey of severe male factor infertility. And I just want to start by acknowledging exactly where you might be sitting right now. Dealing with fertility hurdles, it can feel completely overwhelming. It's isolating, and honestly, it gets deeply confusing when you're suddenly hit with this massive wall of medical jargon. But that is exactly why we're here today. In this patient guide, we are looking directly at resources from ART Fertility Clinics to break down the details of one of the absolute most successful procedures available today, which is called Micro-TESE. Let's clear away all that confusion and hopefully replace some of that anxiety with real, actionable understanding.
Hearing a doctor say that you have zero sperm, a condition that's medically known as Azoospermia, is a heavy, terrifying diagnosis. For a lot of couples, it's this gut-wrenching moment where they feel like their dream of growing a biological family has just completely slipped out of reach. But I want you to take a deep breath here, because getting a diagnosis of zero sperm in a standard semen analysis is absolutely not the end of the road. Today, we're focusing on a remarkable medical advancement that offers a very real, tangible pathway forward, even in these really severe cases.
Okay, let's dive into this. Section 1. What exactly is Micro-TESE?
So let's demystify this massive acronym. Micro-TESE actually stands for Microsurgical Testicular Epididymal Sperm Extraction. I know, it's quite the mouthful, but here is what you actually need to understand. It's a highly specialized process where a surgeon retrieves sperm directly from the testicular tissue. The absolute crucial word here is micro. By using a state-of-the-art, high-powered operating microscope, the surgeon isn't just going in blindly. They are carefully, precisely searching for the absolute best quality sperm. The whole goal of this incredibly precise approach is twofold, really. First, get enough healthy sperm to successfully fertilize an egg. And second, simultaneously protect the delicate reproductive organs by keeping things as minimally invasive as possible.
Moving right along to Section 2. Who needs this procedure?
Well, Micro-TESE is basically built from the ground up for the most complex infertility cases. It's specifically an option for men who have abnormal sperm production. Now, this might be due to previous testicular surgeries that created a blockage, or maybe past medical treatments that ended up impacting sperm production, but it is also a huge game changer for men facing genetic hurdles, or those diagnosed with severe male factor infertility, like that non-obstructive Azoospermia we mentioned earlier, which, by the way, simply means your body just isn't producing enough sperm to actually make it into the semen. If you've been told that past treatments have failed, this advanced technique was designed exactly for situations just like yours.
Now, what's really interesting is how this all comes together. Section 3. How does it work? Before we get into the weeds, I want to strongly emphasize step number 1 here, general anesthesia. You are going to be completely asleep. You will feel absolutely zero pain while the surgery is happening. I know that's a huge relief for pretty much every patient. So, once you're comfortably asleep, the surgeon makes a very tiny, precise incision in the testis. Then we move to step 3, the microscopic search, where they examine the tissue under extreme magnification. The moment they locate exactly what they need, they do a super gentle extraction of the sperm cells. And finally, everything is carefully closed up using ultrafine, dissolvable sutures, meaning you won't even need to go back in to have any stitches removed.
Now, to truly appreciate the genius of this procedure, we've got to talk about the seminiferous tubules. These are the microscopic, tiny little tubes inside the testicles where sperm is actually produced. When the surgeon is looking through that high-powered microscope, they aren't just poking around randomly. They are specifically hunting for these exact tubules, and more importantly, they are looking for the swollen ones. Those swollen tubules are basically the golden tickets, because they are the ones most likely to be hiding the healthy, viable sperm we're looking for.
So what happens the exact moment the surgeon actually finds those healthy sperm? Well, the immediate next step involves a process called ICSI, or intracytoplasmic sperm injection. The retrieved sperm is either used right then and there, or it's safely frozen and stored for future treatments. With ICSI, highly trained embryologists take just one single, healthy extracted sperm and they inject it directly into the woman's egg to fertilize it. It completely bypasses the need for the sperm to, swim or penetrate the egg all on its own, which totally maximizes the chances of achieving pregnancy with the sperm we just retrieved.
And this brilliantly illustrates our next point. Section 4. TESEs versus Micro-TESEs.
I want you to think of standard TESE as an older method that removes tissue samples basically blind, without any magnification at all. It's a bit like searching for a needle in a haystack in the dark. Micro-TESE, on the other hand, brings a massive spotlight and a magnifying glass. Because the surgeon uses that high-powered microscope to precisely locate the sperm-producing tubules, they end up taking far less tissue.
This is exactly why Micro-TESE is the preferred option for severe male infertility. It radically improves the sperm retrieval rates while simultaneously minimizing any damage to the testicle. Simply put, it's safer, it's smarter, and it is far more successful.
Let's shift gears a bit. Section 5. Recovery and next steps. What should you expect?
I think this timeline is going to bring a ton of comfort to couples who are trying to plan their lives around this treatment. The entire Micro-TESE procedure generally only takes about 2 to 3 hours, though, of course, the exact time really depends on how quickly the surgeon finds those sperm-producing tubules. But here is the best part. It is done as a daycare procedure. That means you wake up, recover briefly right there at the clinic, and you get to go home and sleep in your own bed on that very same day. And within just 1 to 2 weeks, you should be fully cleared to get right back to your normal everyday activities.
Naturally, knowing what to expect physically after a surgery is usually everyone's top priority. So let me give you some honest reassurance based on the clinical data. Most men recover exceptionally well. Look, you can expect some mild discomfort or a bit of swelling in the days following the procedure. That's completely normal for any minor surgery, right? But the good news is, this is typically very easily managed with standard pain medication that your doctor will prescribe. It really is just a brief period of mild recovery for what could be a lifelong reward.
Obviously, if you're considering a procedure like this, having access to world-class specialists is absolutely paramount. ART Fertility Clinics, who generously provided the foundational knowledge for this explainer, offers this advanced treatment across a bunch of really convenient locations in the UAE. They have specialized centers in Abu Dhabi, Dubai Jumeirah, Dubai Healthcare City, and Al Ain. Plus, you get access to globally renowned experts like Professor Dr. Human Fatimi, who is a consultant in reproductive health leading these highly critical procedures.
Which brings us to our final thought for this explainer. Look, getting a diagnosis of severe male infertility, or zero sperm, is incredibly daunting. It's scary. But as we've seen today, medical science has built a sophisticated, safe, and highly successful bridge right over that obstacle. Micro-TESE is literally designed to find hope where previously there just wasn't any. So, the question is, are you ready to take the next step toward growing your family? Armed with this clear understanding of exactly how the procedure works, how it actively protects you, and how it dramatically increases your chances of success, you are now in the perfect position to book a consultation and have a truly confident, informed conversation with a specialist. Thanks so much for joining me for this explainer, and I wish you the absolute best of luck on your journey ahead.